Hello, I'm Dr. Brandt Gibson, and over the last couple of days, we've been talking about the different types of nerve fibers. And if you remember, we talked about these sensory fibers over the last 2 days, the large fiber sensory fibers and the small fiber sensory nerve fibers. And in doing that, we reminded you that there are 3 types of nerve fibers in particular: A fibers, B fibers, and C fibers. And as you're going from A to C, you're getting smaller and smaller fibers. When it comes to motor fibers, which is what we're talking about today, the motor nerve fibers, there are primarily 2 that are involved in motor neuropathy: the A alpha and the A gamma. Both of these are large fiber nerves. Both of these are myelinated nerves, and size-wise, the A alpha, as you remember, are the largest nerves, and the A gamma will be between the A beta and the A delta. So they're smaller, but they're not the same. They're still larger than the small fiber nerves that are A delta and C fibers. So as we look at the motor nerve fibers, you're saying, okay, why are there 2 different types of motor nerve fibers? Well, let me explain a little bit about how the muscle works. So the muscle is designed with 2 types of fibers: the extrafusal muscle fibers and the interfusal muscle fibers. The interfusal muscle fibers are small, thin fibers that are on the inside of the muscles that are designed to prevent stretch. So if you start to pull a muscle further than it's supposed to go, these contract through a reflex mechanism that causes the muscle to keep from stretching. These are involuntary. These are not controlled by you. They're controlled specifically by reflex or by the A gamma nerve fibers directly. Now, the voluntary contraction, what you use to walk, what you use to bend your arms and move your hands and so forth, are the extrafusal muscle fibers, which are innervated by the A alpha nerves. And when these are functioning like they're supposed to, they're pretty quick, you have pretty good control, and you could actually cause the contraction that you're desiring, and they will actually work the way they should. If you have a motor neuropathy where it's affecting the A alpha motor nerves, then what happens is you start to get a weakness, you start to get an atrophy of the muscles, and you will find fatigue over periods of time. If you have a motor neuropathy of the A gamma nerves, then where the interfusal muscle fibers won't work the way they're supposed to, this is usually in those situations where you're going to actually have certain types of unique faults. Proprioception or pressure sensation is what is commonly the reason for falls. But if you have a weakness and you're saying, okay, my leg kind of just collapses and I'm unable to hold myself up, a lot of times that can be the interfusal muscle fibers that are failing, or the A gamma nerves. So either way, if you have A gamma nerve malfunction or A alpha nerve malfunction, in these cases, the muscles are not going to work like they're supposed to. You'll get atrophy, you'll get weakness, you'll get even sometimes significant muscle pain. And the idea is you have a second type of motor fiber or motor nerve, the A betas, that really their job is more of a receptors for the muscle spindle. So they will be more associated with some of the discomfort and some of the pain, and often are related to the sensory side of the muscles. So A alpha and the A gamma nerves can be malfunctioning in peripheral neuropathy, and it should be evaluated and determine, okay, what types of motor neuropathy am I having? Although the treatment may not vary that much. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 127, the motor nerve fibers, which is the A alpha and the A gamma nerves.